So what we do about it is when it comes down to a couple of qualifiers, we want to make sure, A, that there's really kind of no big red flags. There's no kind of what's called hemodynamic instability, and that you're not getting worse in terms of the onset of your neurologic symptoms. Provided that's not the case, the best thing to do is to start moving again, really and truly. But what I will say this is, you want to be rational about it. You don't want to move in those ranges of motion that are causing you a lot of pain. Okay. What you may have to do, and this is why robotics are great for this, because what you can do is you can actually constrain the robot. We can actually do these assessments together, maybe in a future Rehab Power Hour, where we can do an assessment and figure out what's a range of motion that's comfortable for you to move into. We can do movements in that range of motion, get you moving, and then slowly over time, that range of motion will increase. And you can imagine it like a balloon, right? Where kind of the boundary of that balloon is the place at which you have pain. And over time, you want to slowly fill the balloon up more and more and more, and such that the range of motion that you have to operate in is getting larger and larger over time. But we don't want to blow up too fast because that can cause problems. And so we want to do this in a very slow and rational way. And so that's what, and the great thing about the robotic systems, they can really help with that process of being very regimented about how we induce the rehab intervention, which is movement in this case.
Oh,
and then like by nature,
the robotics you're talking about, or the thing that you sent me?
Exactly. That is exactly right. So what we can do, So what we can do is we can actually constrain how much it moves you. So let's say, for instance, Rob, we do an assessment and we figure out, you and I work together, we figure out that you can move 20 degrees of flexion and 30 degrees of extension. And anything more than that 30 degrees of extension, 31 degrees, causes you pain, right? What we'll do then is we'll cap the movements there. In that way, for a couple of weeks, we'll just have you move in those ranges of motion that are comfortable for you. And over time, actually what will happen is your brain will recognize that that is not actually problematic. And that range of motion will start to increase, and we can slowly increase that to accommodate your new movement capabilities.
I noticed that when I first start moving it pain, and sometimes the pain starts to reduce as I move it more.
Mm-hmm. That, Ralph, that's a really key thing you just told me there. That is actually indicating to me that it might be, in fact, a more mechanical basis for your pain. Yeah. So this is sounding more to me like it's a more of a mechanical kind of tone, where our muscles and maybe our ligaments and our tendons are a bit tight, and they just need to be reminded that they can move again. Okay. I think the same concept, though, is true. And what I mean by that is we still really want to be rational about that buildup process, because we also don't want to, maybe, for instance, you could go up to a higher degree. In instances when you actually have a lot of that tightness, we may not want to push into those ranges of motion too fast, because we can actually cause potentially tissue damage. Yeah. So we want to, again, be very, very rational about the way that we're dosing this, per se. Okay.